You're also going to want to know like their lab values, of normal lab values, and we kind of find that out from preclinical as well. And you also continuously check their lab values while you're taking care of them to see if they've had any changes, better or worse. And so you kind of cover like the hematology, the white blood cells, red blood cells, platelets, and then you watch the chemistry like the sodium, potassium chloride, albumin, calcium, and just all the other stuff. And then you kind of want to rationalize and say why maybe their lab values are that way. So you kind of have to do some thinking and looking in your books to figure out why it's related to their diagnosis, why their lab values are like this. And so, like for example, bun and creatinine can be increased because they have something to do with their kidneys, renal failure. And then you also look into their meds, and this is the stuff you also do in preclinical. So preclinical is like the basic, like all-nighter, where you do find out all your information. It's like stressful because you're doing all this stuff. And so you get all their meds, and you kind of organize it in the way you understand, and kind of, for us, we had to classify like the route, the frequency, the dose, if it's safe, when it was due, what's the rationale for why you're giving this medication to the patient, the common critical potential side effects related to this medication, and nursing considerations, assessments, and lab work needed for this medication. So medications for me took the longest time. And so for medications, I'd recommend you start it early and make sure you have it on your computer, because like usually if you have it on your computer system and you have different patients, sometimes their patients have the same medication. So if you've already done the work or research on that medication, you can just copy and paste medication from that patient to this patient. So it's really helpful. And with labs, I recommend when you're out preclinical, asking some of the nurses and the staff, their medical staff, like why they think this lab would be at this level, or why is this high, and then if they know the patient and they understand, usually the nurses are really helpful. They can explain to you, and it beats having to go home and research about that lab. So it's one less thing to do in preclinical. And then you have meds, and then you have to do the grading scale on day 1 and day 2. And if they have it for preclinical, you want to write that down so you can see any changes. If they have better sensory perception, moisture has decreased, activity, they're able to move, mobility, nutrition, friction and shear. And then we also had to do the fall precautionary risk factor assessment, and so that you can also do preclinical, and you can calculate it and figure out where your patient is at on that scale. And then for us, we had to do this diagram, box diagram, and we kind of had to separate the different systems and kind of figure out where our patient was and what was their greatest need. And so for my patient in this one, I thought food and fluid, because this person was on TPN, so maybe they weren't getting enough nutrition, so that's why they were giving them TPN. So that was my greatest priority, and that was my greatest diagnosis. And so it kind of helps you organize and balance everything and kind of relate everything around. I don't know if this is what you guys do in your school, but that's what we did for our school. And then for nursing diagnoses, we kind of had to choose the 2 top problems. And with that top problem, we kind of had to figure out, like, we had to write the nursing diagnosis statement. I don't know if you guys did that. It's like the nursing diagnosis, and then you do related to, and then you do the pathophysiology, and then you do as evidenced by, and what data or what information you found out is the one that is the reason for why that nursing diagnosis is there, and then secondary to that nursing diagnosis, or the diagnosis, like peritonitis. And then we also have to write behavioral outcomes or objectives or expected outcomes. And these are in Mostra form. So you wanted to do, like, for example, a goal of patient be able to sip water at least once every 30 minutes on the day of care. So you want to make sure it's measurable, observable, specific, time-bound, and realistic. And then you also had to figure out nursing interventions for that patient, like how it relate to helping them get to reaching their goal, especially with this nursing diagnosis. And then once we do our interventions and we're done taking care of that patient, we do an evaluation at the very end. And we have 2 of these problems, top problems that we take care of. And sometimes you have a third problem if you do both diagnoses, but they don't work out for that patient. So this is pretty much the general gist for what we did for clinical paperwork. I might be talking about it really fast, but that's what we did for our program. It might be a little bit different for you guys, but that's the general. And then besides this clinical paperwork packet and then 2 nursing diagnosis problems we had to do, we also had to do a journal summary at the end of each day of care, kind of like describing how we felt about the whole situation, what we were able to accomplish, and if we felt like we were getting somewhere in the nursing program, or we were taking something we learned in class or in lab and actually put it to use in the clinical setting. So that's pretty much it from my stance on clinical paperwork. If you have any questions related to paperwork, just comment down below. I'd love to hear what you guys did for clinical paperwork in different nursing schools and different programs, or if it's the same thing, let me know. That'd be awesome, because at least I feel better about knowing that a lot of the schools did the same thing and we all went through that stressful period of time doing all this paperwork. So, but I think it's usually the same thing for most nursing schools and nursing programs. We all have to do paperwork. It's just part of nursing school, and we all have to write papers, and so. But yes, that's my gist on clinical paperwork, and I'll look out for my next video. I'm not quite sure what I'm going to be talking about next video, but thanks for watching, and I'll talk to you guys later. Bye!